Welcome to Motivate Monday. Happy Monday. Hope everybody is doing well and had a wonderful weekend and is feeling happy and healthy and motivated. So we are here to talk about endometriosis. My name is Denise Nichols. I am owner of Motivate Therapy, an outpatient occupational therapy and physical therapy center. And we specialize in pelvic health. So I am an occupational therapist and a pelvic floor therapist. I'm also author of Your Self-Care Matrix, a book about how to learn and understand and be aware of your body and all of really embrace change and understand that every day is a transformation. Your body goes through changes every single day, and the more that you understand all of the changes that your body goes through, the better that you'll be, better armed you will be to communicate with your team and really be able to arm yourself with the right team that will help you learn and grow through all of your ages and stages. So that is really what we want to help support you through all of your ages and stages at Motivate. So this month is Endometriosis Awareness Month. And really that is our whole thing here at Motivate, is that you cannot change anything that you're not aware of. That really is our motto. And we truly believe that education is the key to creating awareness. And so that is what we want to do, is help improve your awareness through education. And endometriosis is something that really people aren't aware of and nobody really talks about. And it's something that most people don't know anything about until they go through a big, huge roller coaster to really find out. And that really is the case with unfortunately, most chronic pain and chronic illnesses, is they go through all these different doctors. One statistic is that people, men and women, will go through 20 different doctors, 20 different physicians before they will find the right person for them. And that's very true in the world of pelvic floor therapy, is that they'll have to go through all these different means before they'll find the right help for them. And so I'm hoping that this will help somebody at least start the conversation. And I definitely hear that from a lot of physicians, that once they find us and we start having the conversation, to understand how the muscles can interact with all of the different systems, that just having the conversation. Another statistic is that for women, it takes us 6 years to have the conversation, to talk to a doctor about anything going on down below. 6 years it takes us to talk to a doctor, even to a doctor, a down below doctor, right? Like an OB doctor, about anything going on down below, whether it's, pain with intercourse or leakage or things like that. So, I mean, how crazy is that? It takes us 6 years, right? We go through something, we endure something for 6 years. So I'm starting the conversation today, and I'm hoping that somebody either shares this video, oh my gosh, you need to, this might be you, or this might be my aunt or something like that. So let's talk about endometriosis. Okay, and I know it's a weird word, but really what it is, it's the lining of the inside of the uterus, right? So the uterus is where our baby is carried. So that is where the egg is implanted and where our baby is carried. And so the lining of the uterus is, so the inside of the lining of the uterus, that's where it's supposed to stay, right? The endometrial lining. And so what happens with endometriosis is that the lining of the inside goes to the outside, right? It spreads on the outside and the inside of the pelvis. Okay, so here's the pelvis. So right now, these are the bones of your pelvis. So these are the bones that you're sitting on right now. So pubic bone, your butt bones, your hip bones. So this is your belly. This is your abdomen. So this is what we call the cavity of the pelvis. So your bladder is right here, right? So if you were to push right in your low belly, that's your bladder. Uterus is right in the middle. And so, this is where the baby's head sits and where the baby's head comes out. And so what happens is the uteral lining that is supposed to stay on the inside of the uterus, it goes to the outside. So the tissue that is supposed to be lines the inside, it lives elsewhere. It detaches from the inside of the uterus. And it's supposed to die. It's not supposed to stay, right? Because it's not living inside its house anymore. It goes to the outside. And so it'll attach to other things like the surface. So anywhere, especially it tends to really live where it's closest to the uterus, right? So we know the bladder is right in front of the uterus. So it likes to attach to the surface of the bladder. It especially likes to go behind the uterus. So it likes to go behind. So back here near, so in between, it'll actually connect to the, in between the uterus and the rectum, or the rectum, it can actually go connect to the side walls of the pelvic floor. So you see my pelvic floor, right? The pelvic floor slings from the front to the back. So it actually connects to, so it slings from the front to the back. Okay. So it actually sits right inside, right? So it's the tailbone, right? So if it's to the inside, then it actually can, so the lining of the uterus goes to the outside. So it can actually spread and connect to the inside, it can connect to the pelvic floor, connect to the sides of the pelvis. It can connect to the rectum, it connect to the surface of the bladder, connects to the ovaries. It spreads to the, it can actually go to the large intestine, to the small intestine. It can go up, spread up to the, connect to the gallbladder, the liver, even as high up as your breathing muscle, the diaphragm. And because it's the same tissue as what's inside the lining of the uterus, a woman with endometriosis, when she has a period every month, it bleeds. So there's actually micro periods going on outside of her uterus. So there's actually bleeding going on those other tissues, right? So the uterine lining is now attached to, let's say, the outside of the surface of her bladder, or maybe her pelvic floor on the outside of her, I had said on the outside, inside of her cavity. So now she's not only bleeding inside of her uterus, but she's now bleeding inside of her pelvic cavity. And so that bleeding can create irritation on all those tissues. So the connective tissue, maybe the fascia, the muscles, it can irritate the nerves, and it will create an inflammation. So the irritation, there's not supposed to be blood there, right? So the body will protect that area. It will inflame it. The tissues will get irritated. The muscles will tighten, will guard to protect that area. The nerves will get irritated. That will create maybe some lymphatic fluid to the area. The muscles will tighten. That will often mean less blood flow in, right? More lymphatic flow in, blood flow out. Irritate the area, so the nerves can get irritated. That will affect pain. So that will make the area more painful. Not supposed to be that much pain. And so then we have irritation, we have inflammation. And then possibly, if that's allowed to go on and on and on, then we can have scar tissue affect that area. And then things can go, because if we have cycle after cycle after cycle, where we have bleeding outside where there's supposed to be bleeding, only inside, right? We're not supposed to have all this bleeding and irritation and inflammation going on, and nerve irritation, and the muscle being told to do all this stuff that's not normal, cycle after cycle after cycle. And maybe this young woman, this adolescent who's maybe had her period young, 11, 13 or whatever, and having these horrible, painful periods, and her mother and her aunt and her sister and her grandmother and her mother and her grandmother, they've all had these horrible periods and never really understood what was going on. And so she's not being told that it's not normal. And so now we've had years and years and years of this, right? That could create lots of habitual tensioning And so now this can create a lot of pelvic floor and core problems. So that obviously can create a lot of habits that can affect problems over a lifetime. So the bleeding and the inflammation, and then we get this, what's called a peripheral sensitization. So the nerves get really hypersensitive. And now we have this like a fear type of hyperreactivity. So we have this mind-body connection now where maybe it starts out where she is just having these horrible, painful periods, but then now we start to feel it and we start to anticipate the pain is happening at ovulation. And then now we started out just having painful periods, so like a couple of days, and then over the course of a lifetime, it isn't getting caught, and so now we're missing school, and then we start missing work, and then, like I said, if it's been passed down, it can be in the family. It can be passed down, unfortunately, and if it's not well understood and it hasn't been caught, then it can really affect your quality of life. And if it hasn't been understood, and mom and grandmom think that pain is normal, and things that can really, really affect is the three main things are painful periods, like I said, pain with intercourse, and not just pain with intercourse, but pain with penetration in general. So really painful penetration includes inserting a tampon, maybe like you just can't handle it. There's just no way you can't handle a tampon, and that's not normal. No way. I hate completely just fear having any kind of a speculum, any kind of a pap exam. I don't want to go to the doctor. Even having their finger inserted just makes me want to jump through the roof. That's not normal. And then pain, with intimacy, fear of intimacy because of the pain. That is just not, that's not normal either. If you have to just kind of suffer through intercourse, that is not normal at all. Intimacy is meant to be pleasurable. It truly is. And if you're having to just suffer through it, that is completely not normal. And I truly will say it right now that I don't care what if a physician is telling you that it is normal, it is not normal. And that is why I say, keep calm and listen to your body. You have the right to be heard. And if you are having these perpetual painful situations that are affecting your quality of life, and you don't feel like you're being heard, and you're being told that all of this is normal, then you need to keep talking and keep listening and keep learning. That's my message. Okay, so understanding your normal is really important. But if your sister and your mom and her sister and grandma and all of that, if their normal was really painful periods, and then they were missing school and work, and they've always had, pain with intercourse, and have learned to fear intercourse, and then pain with defecation, pain with pooping. That's another one as well. Other things, urinary incontinence and fecal incontinence, that's another big one. Can happen as well because of the muscle tension. So if you're having pain and anticipatory pain, so you start to have pain, so the muscles just start to learn to tighten. And then if it's just the first week of your period for, your first few years of life, just they tighten, and then you learn to just, like your body has learned that this is kind of the normal. So one cool thing that we do, and it's a really cool modality, and not everybody understands it. So I think, unfortunately, it can get a bad rap, but it's a really an amazing tool for awareness. And it's a very research tool called Biofeedback. So it has showed us that right now, you sitting there, we have a baseline in our pelvic floor. So hopefully you're not peeing or pooping your pants, right? And because it has showed us that there's a baseline. There is an activity going on. Your brain is telling your floor, so the muscles that wrap around your vagina and your rectum is telling you to keep them, there's a resting tone to keep them slightly kinked around the urethra, right? You're not peeing or poop and your sphincter, right? So right now they're active. You're slightly kegling, but you should not have to think about it. You should not have to go, Kegel, she's talking to me. Kegel, she's looking at me. Kegel, I'm going to stand. Kegel is the term for like squeeze off the flow of gas or squeeze out the flow of urine and then relax, right? So you shouldn't have to think about it. Your brain is telling your muscles to do something, okay? And that resting tone is 2 microvolts of activity. And then I ask you to squeeze, that should increase. I tell you to relax, it should immediately stop. So that's what biofeedback does. And we can watch what you do. And what we've seen is somebody that has learned to fear intimacy. So it's dyspareunia is the term for pain with intercourse or pain with penetration. Sometimes I'll just reach towards even their head and I'll see that resting tone go, whoop, it'll increase because the brain has learned to go, oh, tighten up, tighten up, tighten up. So if you're sitting there right now, there is 2.0 microvolts of activity. I ask you to squeeze, it goes up, and then now I say relax, it should go down. Okay, but somebody who has had endometriosis and there is a chronic inflammation going on because of those little micro periods, right? And so there's maybe years and years of it going undiagnosed and untreated. And so now there's all that sticky little bleeding and maybe some scarring and things going on. The muscles have learned to protect that area. So maybe now your resting tone, just walking around, is maybe a 5 or something. So those muscles so not only your floor, right? Not only here, but it's also your hips and it's also your back and it's also your belly, right? So now you're walking around and your body has learned your posture and your walking and your gait, right? Your gait, which is also your balance and how you're running and how you're playing tennis and golf and your flexibility, all of that stuff is affected by this. And it's also your stress levels, your nerves, everything, pain, your intimacy. So if this is your relaxed position, imagine what it's like to try to stretch. That's what has to happen in order to allow a partner in, right? And then to be able to relax, to be able to have an orgasm, all of those things are affected. So that is why endometriosis can truly affect your quality of life, let alone, right? So if you wake up like this and then you have to go to school and focus and concentrate. So that is why understanding what your baseline is and to be able to communicate what your normal is and then understand what, because ignoring and enduring pain or tension or what your normal is, just pushing through that, at some point your body's going to break. And I always say that understanding, listening to your body's signals before they become symptoms is much easier to deal with. So that is why listening and learning and then communicating with your team and finding the right team is really an important thing. And if you have endometriosis and you have chronic pain going on, finding a pelvic floor therapist is crucial as far as I'm concerned, because we are here to help educate and empower you, and then help you find your baseline, right? Lower the baseline, and then teach you how to maintain that. And that is how you can learn to live and manage and have a true quality of life with this condition. So, because there's endometriosis and then there's chronic pelvic pain, you don't have to have both. Okay. So have you built your life around your period? That's really what it comes down to with periods, as far as what is your normal with your period. Because if you have built your life around your period, that's not normal, right? That's really what it comes down to if it's, do I have endometriosis? And if I do have endometriosis, is it a big deal, right? And if it's only a big deal if you've built your life around your period, as far as, you're not gonna go anywhere, you're tracking it constantly, that, on day, 23 to 28, you're not going to leave your house, those kinds of things. I mean, that's just not cool, right? Okay, let's see. Anything else I wanted to say? Oh, a couple other interesting statistics is 1/3 of people with endometriosis have IBS, irritable bowel syndrome. Again, I think a lot of it is because how that those tissues and the irritation can spreads up the cavity. So it goes up the cavity and into the intestines, right? The intestines are all through here. So all that inflammation and irritation affects. So irritates, irritable bowel, right? And then also, so here's the bladder. So it also irritates, so interstitial cystitis, so itis, inflammation of the bladder. So we always want to blame the bladder with interstitial cystitis, which is painful bladder syndrome. So, so symptoms with interstitial cystitis is so pain with peeing, pain with the urge to pee, those kinds of things, or constantly feeling like you have to pee. Irritable bowel can be either constipation or diarrhea, and the same thing, feeling the constant urge to go. Another interesting thing, is migraines with endometriosis is very high, up to 1/3 have migraines. Again, I think that the constant irritation of the nerves, and there's that mind-body connection, right? So the nerves are constantly irritated. It's going to affect the computer, right, where the nerves start. So this month, we're going to be talking more about natural ways to approach pain relief. And we are rolling out overall our programs, our classes and courses we had talked last month about overactive bladder. We're also this month going to start talking more about our chronic pelvic pain program. I have some cool interviews coming up with an OBGYN regarding endometriosis. And I also have an interview coming up with a physiatrist regarding pain approaches for chronic pelvic pain. And we'll be talking more and more about different natural approaches for inflammation and using different things like TENS and diaphragmatic breathing and down training, autonomic nervous system quieting. There's lots of amazing things that you can do for yourself. There is always hope, but the biggest thing is understanding. The more that you understand your body and what's going on with your body, and ignoring and enduring is only going to send you down the spiral. Listening and learning and asking for help and finding the right team for you will bring you up the spiral, but hand in hand, not alone. And I think that's a really important thing to understand. One other thing about endometriosis is how it's diagnosed, right? So I did want to talk about the statistics as far as with the prevalence of them, it takes several years often, before it gets diagnosed, and it's often misdiagnosed because of the lack of knowledge and awareness of the condition, which is why you have to listen to your body. But it needs to be diagnosed laparoscopically, which is surgical. And it takes a minimally invasive surgery. Which is, they will do a small little incision in the abdomen. But obviously, the longer the symptoms go, the greater the risk of developing the related conditions, like I said, IBS and IC. And the chronic pelvic pain is if it's lasted longer than 6 months. And unfortunately, it does often last longer than 6 months. But so they go in laparoscopically, and then they look for those pockets of the blips of the lining, outside of uterus. And then they try to excise that tissue off of, the surface of the bladder and the bowel and wherever they find it. As you can imagine, it can be tedious to make sure that they are, keeping the health of the other organs and the floor and those kinds of things. And they rate them in stages, as far as how much they have found from stage 1 to up to stage 4, I believe. And I've heard too that as far as the prevalence of pain, that you might be a stage 1 as far as which is more common. We might not have a ton of the tissue and adhesions, but you might have a high amount of pain. Whereas someone with stage 4 has a lot of the adhesions and endometriosis, but not a lot of pain. So it can be interesting, right? And so then after surgery, then they do expect your next period to be really painful. But then after that, the next few months, it should continue to get better. But over the next 2 years, really they do expect pretty much complete relief if that was truly the source of, your pain. However, chronic pelvic pain can obviously be more complicated than that. There can be a lot of other issues. And unfortunately, if it was allowed to, go on for longer than 6 months, which it can, because it can be so hard to diagnose and difficult to find, the right person to help, then the chronic pelvic pain may or may not have been related to the endo. So if the endo has been excised and it's gone, and then you're still having the pain, then it may or may not have been related to the endo. But the endo could have created the issues, the inflammation, the nerve pain, and those kinds of things. And now you still can learn to manage the symptoms that then came from the issues, such as the inflammation and the nerve pain and those kinds of things, such as living with any kind of post syndrome. And that's kind of how I look at it. But like I said at the beginning, every day is a transformation. Every day is an opportunity to learn, to listen to your body signals, and to transform. I think that's really the best way. So embracing change, learning how to create consistent, healthy habits based on awareness of the now, so that you can grow, you can let go and then grow forward and be empowered. So that's my acronym for change. And that's what we say at Motivate, is that change starts here. And if you want to learn more, you can read this blog on motivatetherapy.com in our blog section, and you can watch this replay on our YouTube channel. Please subscribe to our YouTube channel to stay up to date on our latest exercise videos and these types of educational videos, as well as the interviews that will be coming out, and our courses and classes and memberships and all kinds of new exciting things that will be coming out this year. And if you learned a lot, and like I said, we like to talk about things that no one else likes to talk about. So the only way that we're going to get more and more people to talk about this stuff is if you help us. So please share and like, and please continue to self-care and have a wonderful week.